Next we'll call Dr. Niraj AGRAWAL, who is going to present on comparative analysis of optical biometry, lensometer versus IOL master in silicon oil filled globe.
A very good afternoon to my judges and all. So my paper is the comparative analysis of optical biometer, Lenstar versus IOL master in silicon filled eyes. As we all aware that a silicon filled tamponade is commonly used as an adjunct for vitreoretinal surgery, and success in visual improvement following cataract surgery in such cases depends upon the axial length measurement and the precise IOL power calculation. So the purpose of the study was to analyze the biometry result in a post-vitrectomized silicon filled eyes that underwent phacoemulsification. As we know that IOL master uses the partial coherence interferometry to measure the axial length, whereas the Lenstar based on the optical low coherence refractometer. And both the biometers provide the high resolution non-contact measurement of the ocular biometry. It measures the axial length in the visual axis and both measures accurate axial length in the silicon filled eyes. It was a retrospective non-randomized case series where 82 silicon filled eyes underwent uneventful clear corneal phacoemulsification with IOL implantation and silicon vial removal. The study was conducted between Jan 23 to March 2024 in Disha Hospital, India. And the intraocular lens power was calculated using the SRKT formula targeting for ametropia. The post-operative refraction was performed in a span of 1 to 3 months. The mean absolute post-operative refractive error was analyzed both in terms of the preoperative axial length and the type of retinal surgery. This is the graphical representation of the axial length, where the mean axial length in the both category was comparable. This is an absolute post-operative refractive error, where the axial length was further divided into less than 24 mm and more than 24 mm, and the both groups, the mean axial length was found to be comparable. The absolute post-operative refractive error in terms of the type of the surgery, the pars plana vitrectomy or pars plana vitrectomy with skull buckling, both the groups, the mean, absolute post-operative refractive was comparable in both groups. In terms of the percentage of the refractive error, it was divided into less than 1 diopter, between 1 to 2 diopter, and more than 2 diopter. In all the three groups with the two biometers, the results were comparable. Looking at the literature, there was a paucity, and almost I didn't find any study where the two biometers was compared, particularly for the silicon filled eye. There are the few studies where they have done a study where there is a mixed group for the pseudophakic, aphakic, and silicon filled eye. This was the study was done by the Casper Rosser et al. And he has done a prospective study with a sample of 144 size with small subset of 14 silicon filled eyes. And they found that the measurement with the Lenstar correlated well with the IOL master in cataract, pseudophakic, aphakic, and silicon filled and the normal eyes. To conclude, the refractive outcome in both groups were similar irrespective of type of surgery and the method of biometry. Lenstar and IOL master showed a good correlation for the axial length measurement in silicon filled eyes. And finally, the optical biometry, Lenstar or IOL master are comparable and reliable in silicon filled eyes. Thank you.
Thank you, Niraj. Did you do all this in silicon oil mode or regular mode?
In the silicon filled mode.
How does it make a difference in these? If you put in silicon oil mode, what changes in the machine? What is the change they are doing in silicon oil? What is the change which can happen when light goes in this fast, this small length? How does it differ?
There's the slowdowns that,
but
normal
thing is,
biometry you go
slowing down, ultrasound slowing down is fine. But the speed of light, the speed of light and the size of the eyeball. I was always wondering, but anyway. And the refractive error residual, which you said comparable, but you had 1 diopter, 2 diopter and all.
Yeah, that was divided into all the threes.
That's right. That is similar in groups is fine. But why did you get this kind of 2 and all?
That's what
These are the highest end machines which can be used for calculating the IOL power.
Yes, sure.
Both are comparable. But then there are cases which
there
had
cases
2
where
diopters and all.
surprise was more. There was the refractive error was more than 2 diopter also. We get that.
But that should not happen, no, with this kind of. Why do you think it would have been?
Cannot pinpoint that.
Anyway, and formula, why did you use SRKT when all these had Barrett's easily available in that?
That was, we are used to that SRKT.
Try using Barrett, because I was seeing the refractive error residual, and you have used the SRKT. Please try it. It's free in both these machines. So please try to use the Barrett and see, you'll get better outcomes. Good, thank you.
And that one is how many cases they get -1, -2,
That
-4.
numbers are
That
not clear.
numbers you are not clear.
That numbers are not clear.
Okay, that's also not clear. Because once we know the number, then we can say which one is better and which one is not better.
Okay. Sir.
Okay?
Okay.